Yeah, hi, this is Dr. Yates, and doing another post-op visit, and my patient Yaba is about a year out, not quite a year, but about 10 months out from his ARTAS procedure. You come in with the camera and hold your head down a little bit. We created a frontal forelock. This is 1,000 grafts, and that's all he wanted at the time because he wanted to kind of test the water, as he told me. He said he wasn't sure, but he wanted to test the water, and we started with 1,000 grafts. And I think he was completely bald here. For 1,000 grafts, I think this is a phenomenal result as far as the forelock. And also in the back, if you come around, turn Yaba, the back of his head, as we always do, for 1,000 grafts, we did the ARTAS robotic system. You can't tell, you can't feel, and I always tell patients, because a lot of guys come in here and they say, well, you can't see my scar. And I'll say, that's true, but I can feel your scar. And what that means is that there's a healing ridge with kind of a big bump of collagen back here that you can feel, but I can feel nothing on him. He could shave his head, no one would know. So let's come around to the front again. So what we're doing now, since we tested the water, so are you okay with how it looks?
I'm okay.
How did your friends like it?
My friends like it, my families like it.
Right, looks natural, right?
Yeah, it looks natural.
So he tested the water with 1,000 grafts, and now he's back because he's a believer. And we always say, well, the proof's in the pudding. He's a believer now, so now we're going to do a little bit more. And what we've kind of got worked out here, if you come in with the camera, is to thicken this area in the frontal area. You always want to maximize the front of the face before you go in the back, okay? So we're going to thicken this whole front and mid scalp. We're also going to kind of pull out his temples a bit here. You can see his temples are a bit washed out, so we're going to bring that out. Same on this side. Bring the temples out here. Thicken this front and mid scalp, and kind of hold your head down here and kind of end up here at what we call the vanishing point, where if you take your finger from the front, this is as far back as you can see from the front, where his head starts to dive down into that descent. So we're going to take it from here. What we're going to do in this area here, we're going to do approximately 2,000 grafts. So we're going to do more than we did before to add density here, pull out his temples, and go back a little bit further. So I'm going to show this to you, Yaba, and see what you think. I drew all my schematic lines here. Stay with your hairline kind of here. Bring out these temples here and just kind of go back to here and add more hair in here, because we got a good framework. And this is a good thing to note, that when you have a hair transplant, you don't have to have any more. A lot of people are saying, well, if I start doing this, I'll be committed. That's not the case with the ARTAS system, because there's no scars, or there's no trace on the back of his head he's had anything. And you can see here, this hair looks completely natural. So if he stopped here and say, hey, I don't want any more hair transplants, he would be perfectly fine. He wouldn't have to do anything. He doesn't have to take anything. He'll have this hair up here for the rest of his life. He could stop right here. But like most people, they want to do more, so we oblige him, because I think he should do more, and we're going to do more. So we have him scheduled for the next 2 to 3 weeks. So when we do his procedure, we'll probably take more videos so you can see the procedure, and then when he comes back 6 to 8 months later, we'll show you this again. This is Dr. Yates. Thank you.